Thank you for being here today. We're happy that you're here. My name is Michele Bachmann. I'm a United States Representative from Minnesota's 6th Congressional District. We're here to speak about the issue that came up last week regarding Medicaid, and I have a prepared statement that I would like to read. In the past week, we learned from Governor Mark Dayton's Commissioner of Human Services that the state of Minnesota is currently under investigation regarding our Medicaid program. The issue involves the massive reserves that are accumulated by 4 Minnesota nonprofit HMOs who manage Minnesota's Medicaid program. The state and the federal government together jointly fund Medicaid. We as lawmakers have an obligation to ensure that Minnesota payment and oversight practices are both accountable and transparent, and that they protect the flow of federal dollars that today are providing the care of 740,000 elderly and needy people in the state of Minnesota. And because the future of the Medicaid system will greatly expand under Obamacare if it is not repealed, it is apparent now more than ever that we must take action. The Federal General Accountability Office in August of 2010 published a report that was critical of the lack of oversight by the Centers for Medicaid and Medicare Services, also known at the federal level as CMS, of the Medicaid rate-setting process. It's also important to recognize that CMS will provide the oversight and supervision of Obamacare as well. Let me quote from the GAO report. It is called 10-810. When reviewing states' descriptions of the data used to set rates, CMS officials focus primarily on the appropriateness of the data rather than the data's reliability. With limited information on data quality, CMS cannot ensure the state's managed care rates are appropriate, which places billions of federal and state dollars at risk for misspending. That is why we are here before you today. It appears that lack of oversight creates a climate of complacency, which sets up the federal government taxpayers to be victimized through fraud. In the history of Minnesota's Medicaid program, there has not been one true third-party independent audit since the inception. So the question at hand is this: are nonprofit HMOs certifying a level of risk that may or may not even exist in order to draw down massive amounts of matching federal funding? Last year, one of the nonprofit HMOs in Minnesota suddenly returned what they described as an overpayment of $30 million to the state of Minnesota. We do not even know how this HMO nonprofit came up with this number. We do not know if other nonprofits owe repayment as well. And we don't know if nonprofits have been overpaid for years. The lack of federal oversight is absolutely shocking. The GAO has acknowledged this, and we are now going to take steps to correct it. That is why I am announcing today that I am directing my staff to examine legislative fixes to require periodic, true, third-party independent oversight and audit of federal Medicaid dollars. Our nation is more than $15 trillion in debt. It's crucial that taxpayer dollars are spent wisely. So let me be clear. We are not here today to accuse anyone or any of the current nonprofits in Minnesota. We are just doing our due diligence because providing transparency and accountability is just Minnesota common sense. It's time that every single dollar of federal funding is accounted for, and every instance of misallocation or misspending must be stopped. Minnesota taxpayers and the American people deserve nothing less. We are excited about what we believe will be bipartisan legislation. I anticipate very soon reaching out to both Republican and Democrat members of the House of Representatives, as well as both Republican and Democrat senators in the United States Senate for this very important piece of legislation. And now, State Senator Sean Nino.
Thank you all for coming here. You might or might not have been aware last week. I've got a copy of the bill here. My assistant has copies if those of you want to see it. A bill was introduced on this subject in the Minnesota State Senate. If it hasn't been introduced in the House yet, it will. There are both Republican and Democrat authors in the House and in the Senate. As the Congresswoman mentioned, this potentially is a big problem for the federal government, but this potentially also has connections with the Federal Affordable Care Act, Obamacare. The Senate HHS committee had an overview recently of the work that the governor is doing and the results from the Exchange Task Force. And one of the recommendations in the Exchange Task Force relates to rate risk setting and risk pools. And they wanted to leverage potentially state-specific benefits. When I asked what that might be, I didn't get a full comprehensive answer. But CMS, according to the GAO, the General Accounting Office reported 2010, CMS doesn't have the proper requirements, if you will, to make sure that the numbers in that risk setting are done properly. Now, if we're going to put this in the context of going nationwide with an Obamacare proposal, that's a serious concern at the federal level. At the state level, we clearly have the same concerns. We need transparency, we need accountability, we need the independent third-party audits. We have more than a dozen reports that the various plans put together now, but the question is, do they mean anything? And I brought this point up in the recent hearing in the House, the joint hearing between the two HHS committees. I highlighted the General Accountability Office report, and I suggested to them, and certainly we'll ask this question in the Senate, I suggested to them, when you're hearing about CMS certifications, when you're hearing about reports that are done on the plans and what's been provided, ask the question, does it mean anything? Is the underlying data really worth the paper it's printed on? Maybe it is and maybe it isn't. And it was interesting. After that meeting, I happened to have a brief conversation with the legislative auditor out in the hallway, and I told him thank you for coming because he was there for the entire meeting. And he said, no problem. He's going to be looking into this. And he looked me in the eye and he said, you were exactly right with your comments there at the end of the meeting. We need to know if it means anything. And speaking a little bit to that, I want to now introduce Senator Benson.
Morning, and thank you very much. Michele Benson, I serve Him Andover and Coon Rapids. I am a CPA and sit on the Health and Human Services Committee. And in understanding this issue, I've done a little digging, and our health plans undergo a number of audits by CPA firms, by CMS, the Department of Commerce, by the IRS, the Department of Human Services, and they issue multiple reports, as Sean told us. And what we're getting is a lot of data and not a lot of information. So while we're going through this process to improve our transparency, we need to reduce some of the questions we're asking just to those core things that will actually give us good information instead of doing data splatters. And the HMOs aren't doing the data splatters. It's something that has been requested year over year over year by politicians. So it's time for us to clean up, to work with the vendors who run these public programs and make sure that we have enough oversight to know that we have good fiduciary use of our taxpayer dollars.
Kathy, introduce yourself. Hi, my name is Representative Kathy Lomer. I represent a portion of Woodbury and Stillwater and the surrounding communities there. And I serve on HHS in the House of Representatives. And I want to thank Congresswoman Bachmann for being here today and for Senator Nenow and Benson. This is a bipartisan issue. I just want to say that. And we have introduced legislation in the House. Representative Lane and Representative Gottwald have each brought forth legislation. We also had the first hearing in the House last week, so I'm excited that we are moving forward with this. This is about transparency and accountability. Thank you very much.
Any questions?
Congresswoman, you mentioned the $30 million give back from UCare on this overpayment. The other three HMOs would have participated in that GAMC program equally. Are you concerned that if UCare had $30 million in overpayment, that the other three would have had overpayment too, and would you seek for them to give some of that money back if they did?
We want the monies handled accurately. That's what this is about. And I'm very grateful for Senator Nenow. He really was the one who initially brought this to the public's attention. And no matter which of the HMOs, if there have been overpayments, they need to be returned to the state of Minnesota and to the taxpayers of the state of Minnesota. But this also could be the federal government money as well that's at risk. All we are doing is our due diligence as legislators, both at the federal level and at the state level. We're just here to look out for the taxpayers' money. But again, I want to reiterate, we are not here today accusing any of the HMO nonprofits, nor are we accusing the state of Minnesota for doing anything wrong. We just don't know. That's the problem, as Senator Nenow said. The data clearly is unreliable, practically useless, according to the GAO report. That's why I quoted from the report. When we are looking at the state of Minnesota potentially having billions of dollars that can't be adequately addressed and accounted for, that's in a state of 5 million people, or approximately 5 million people. Imagine for a state like California, or Texas, or Illinois, or Florida, or New York. Imagine the billions and billions of dollars across the country. Then amplify that money once Obamacare comes into place, because Obamacare will essentially be the expansion of Medicaid. If we can't have supervisory overview by CMS today, what do we expect in the future? That's why this is so important. That's why this is not a partisan issue. And that's why both the House and the Senate at the federal level needs to take this example that was brought forth here in Minnesota, and we need to give this a national spotlight.
Do you know which arm of the federal government? Is it CMS or the Justice Department? Do we know yet, or who's looking into this?
Well, we will be looking at this, I think, whether it's Justice or whether it is Health and Human Services. We will be looking at this. We know that the Health and Human Services Secretary, Kathleen Sebelius, is overall involved in Obamacare and the implementation. But again, CMS will be the superintending entity that will be overlooking Obamacare. And from the GAO report, we know the data isn't worth much at this point. And I think that goes to Senator Benson's point. She said there has been report after report after report, but they tend to be useless reports. We need to have maybe one report that's actually worth something, and that's what we're hoping for.
You all have all said that this should be a bipartisan effort, but I don't see any Democrats up here. Did you reach out to them for today's event?
I can speak to that. I received a call from the Congresswoman from the Congresswoman's staff over the weekend, and I didn't have a chance to reach out to anyone's office. It just was some word of mouth. In fact, this morning at 8 o'clock, when we tried to make sure that this room was available, we found out that there was a stadium press conference. We had a quick scramble to try to get that all together. I can tell you that Senator Marty's assistant is in the back of the room right here, and she would tell you that both John and I have worked very well together on this particular issue, and our offices have coordinated closely. So if you want to confirm that, just at the end of the press conference, go straight back there and talk to her. She's right back there.
And I would add, too, Rachel, that this issue came to my attention because of the good work that was done by Senator Nenow. And so I contacted him over the weekend when I came back to Minnesota for the weekend and told him that we needed to do something immediately about this issue because of the money and the issue that was at stake. I'd read the reports about Governor Dayton putting together an audit, and I applauded his effort doing that as well. Again, this is bipartisan. And so I contacted him and asked if he could come so we could show that together the state and the federal government need to work together on this issue. That was really the reason. This wasn't to exclude anyone. We intend to be very inclusive going forward. We need to be united on this effort. We need to be united at the state and the federal government level. We need to be united, both Democrats and Republicans. This is not a partisan issue. This is an issue of financial integrity, and I think that's an issue that interests both Democrats and Republicans.
And I will also add on to that. There are the bill that I referenced here, I introduced, there's actually two versions. I'm the chief author in the Senate of both of those, but in the House, we intentionally had Representative Lane and Representative Gottwalt are going to be chief authors so that there's two copies of that, and I expect they'll probably have bipartisan co-authorship. Certainly the Senate bills are bipartisan as well.
Do you think the Democrats might be more open to this if you stop calling it Obamacare?
Well, this, specific to Minnesota, is not an Obamacare thing. At the federal level, it really is, because that's your concern. At the state of Minnesota, we don't have any way to affect that. We just simply have to comply with the law to the extent that the law exists.
Are you planning to introduce any kind of legislation at the federal level, or are you working with your colleagues at the federal level to perhaps incorporate something similar to this at the federal level?
I am planning to introduce legislation at the federal level, and that's really the purpose of this press conference as well, to let people know that I intend to do that. I instructed my staff over the weekend to begin this process on legislation, and we will be, again, reaching out to our Democrat colleagues so that we are originating this in a bipartisan way. And this problem has been identified in Minnesota, but my opinion is this will not be a Minnesota-specific problem, as we are all looking for scarce resources. I think every member of Congress, both in the House of Representatives and at the Senate level, will be interested in knowing that the current federal monies are being used wisely and effectively. And so I don't anticipate in any way that this will be an issue where anyone will see this in a partisan vein. But we need to have the legislation federally because of CMS and the expansion of Medicaid under CMS, but we also need to have this legislation at the state level as well. We want to work hand in hand because we want to solve this for the benefit of the taxpayers. Looking at our current publicly held debt, we have to be mindful of these important dollars. We want to make sure they're spent well.
Congressman, would you ask Mr. Feinwachs to come testify in Congress about what he's uncovered in his lawsuit?
I think we want to reach out to anyone that has brought forward information. The nonprofit HMOs in Minnesota, we want to ask them for their input. Again, we are not here to accuse them, simply to hear what their side of the story is. We want to hear anyone who has reservations or concerns about the current reporting requirements that are going on and the usage of these monies, and we intend to work with the states. Again, we don't think that this is just Minnesota that has a problem. We think this is probably, if it's uncovered here, we think there's a very high likelihood that these issues could be handled other places as well, because of the GAO report, that there isn't any proper guidance on the collection of data so that it's reliable. And again, as Senator Benson stated, as a CPA, we must have reliable data, and that's what we're looking forward to.
Some of the reporting on this issue has suggested it's a problem that began with the Dayton administration. Can you clarify that? Does this go back further?
We are not suggesting when this began. We don't know. We're really in an information gathering process. We aren't casting aspersions on any political party or on any governor or on any administration, because again, we don't necessarily believe that the problem is confined just to Minnesota. We think that it may be across the country as well. And so we're grateful for Senator Nenow and his leadership and the fact that he discovered this problem, and that the Senate and the House in Minnesota are taking firm resolve because they want to get it right. That's what I want to do at the federal level, get it right, because it's about making sure we are proper stewards of the taxpayers' money.
Congresswoman, can you talk a little about how your life has been since the presidential run and why you decided to run for Congress again, and looking forward to that campaign coming up?
I'll be glad to do that, but not at this press conference. This press conference is strictly devoted to this issue. So if there's any other questions, we'll be happy to answer them.
Is it the high reserves that caught your attention on this? Because the federal government does allow for a certain amount of reserves, so they don't go insolvent with the HMOs. But ours appear to be anywhere from 2, 3, 4 times higher than most other states. Are the reserves with these HMOs what concerns you the most?
My legislative staff had informed me that some of our reserves could potentially be as much as 33% more than any other state in the country. When that issue came to our attention, we decided that this was something that we aggressively needed to pursue. And again, I want to underscore, we are not here to accuse anyone of wrongdoing. We simply don't know. We want accurate data so that we can find out what the true result will be. And I don't know, Sean, if you have something
Well, just to springboard on that, what it comes down to is what we've said. We don't know that there's a problem. It's just that we don't know that there's not. And that's where it comes down to the data, the accountability and the transparency, and being able to, if there's no problem, if everything is perfect and right and tight and the SS Minnesota is sailing along perfectly, I'm okay with that answer. I just need to get that answer. But if there is a problem, we need to know what it is so that we can get it rectified and get the ship righted.
Because even if it is a small problem, even if the one thing we do know from the GAO is that the data is not necessarily good data to work from. That should be rectified anyway. And so this is just an opportunity, I think, for us to rectify the data so that it's usable. And again, I think it's important to expand this beyond Minnesota. I doubt that this is only a problem here. We don't know. Maybe it's just confined to Minnesota. But my guess is the bigger the pot of money, the more the need for accountability and transparency. That's what we're here to talk about. And that's why this is not a Republican issue. This is a bipartisan issue, because I believe that Democrats also want transparency and accountability as well.
What data are you looking for, Senator Nino?
Well, the bill that I introduced, it's a 3-bullet point proposal. There's 3 things. The key underlying piece is the third-party independent audit. And in order to do that, you have to have access to what we call the granular encounter data. Basically, if Mrs. Johnson is on the public plan and goes in for a broken leg, I don't need to know that Mrs. Johnson went in, but I need to know how many Mrs. Johnsons went in and what we paid for those and all of that encounter data, and be able to reconcile that so that, to quote one of the emails that has been out there, so that it adds up to 100% somehow. And then the third item of the 3 bullet points is that it would be a statutory prohibition on the state's actuary working also for the plans. And to put that into a real-life example that you might understand, it's a bit like being a defendant going into court and finding out that your lawyer is also working for the plaintiff. That's a bad idea. And currently that is not prohibited in state law. And there's some indication that maybe that has been the case, that our actuary has also contracted with some of the plans and has been on both ends of that table. And that should not take place. And so that's the 3rd bullet point in the proposal. Independent third-party audits with access to the granular encounter data, and then a prohibition on our actuary, who sets the rates, on being their actuary, because they benefit potentially from those rates.
And again, that's why we want to have a true independent third-party audit, and it's shocking that we have never had one. And the definition would be someone who doesn't have a financial interest or a political interest in the outcome of that audit. We want a true audit, independent audit.
And the problem with the Commerce Department during the audits that Governor Dayton ordered is that their expertise is with the private insurance market rather than public.
Well, John, let me tell you a little story, and you can go back and watch the video from the press conference with the House. There we go. There we go. And the Department of Commerce was at that joint House committee hearing. And there were some questions about reserve levels and what's appropriate, what's not appropriate. And I'm paraphrasing. You can go back and watch the video. But the representative from the Department of Commerce said, well, specifically to these private programs, the private sector programs, I can answer that and talk about this and this and such. But when you're talking about your public programs, that's a little bit different of an animal, and maybe you should ask that to Commissioner Jessen, who's sitting right next to me. Basically saying, in not so many words, I don't have the expertise to answer your questions on this. So the Department of Commerce essentially testified to the fact that they do not have the expertise.
Congresswoman, you expect your federal bill to be similar to his bill on the state level then?
It may not match exactly. I think there will be differences, but we are aiming at the same goal. That's what we want to do. This is unity among both the states and the federal government, looking for accountability and for transparency.
And you've traveled the country more than most people lately. You've never heard this problem anywhere else in any other state?
This is the first I have ever heard of this problem. It was brought to my attention at the end of the week, and so when we heard about this problem, we did some initial investigating on our own, and then over the weekend I called Senator Nenow and told him that we were looking into, because of the widespread implications for billions of dollars, again, not just in Minnesota but across the country, that we felt that it was incumbent upon us to do our due diligence at the federal level and demand accountability, because we believed that his bill was going in the right direction. And that's why we were very thrilled to hear that both Democrats and Republicans are introducing virtually identical bills at the state level. And so we believe that with that show of unity here in the state, we should demonstrate that show of unity at the federal level, and that's what we intend to do.
And you haven't talked to any of your colleagues in Washington?
Not yet. Well, Congressman Kravac I spoke with briefly about this issue. He was sorry he could not be here today. Congressman Klein, briefly, I think my staff spoke to his staff, and they had expressed interest, but we've just begun the initial phase of this, we will reach out to all in the Minnesota delegation, Democrat and Republican, and invite everyone to join in on this legislation. And we'll also ask for a Senate sponsor as well.
You said the initial look suggested reserves in Minnesota were 1/3 higher than elsewhere. Is that what I heard you say?
Where did that come from? What's your source on that?
That information, did you have that information?
I didn't.
Was that Mr. Feinwachs?
I'm not sure.
I'm not sure. But that would be, I'm sorry, I don't have the legislative staff here right now to answer that question. They could answer the question. We'll get it to you. We'll get it to you after the press conference.
Right then. It's just
we'll get it to you after the press conference. But thank you for asking. We'll get the clarification.
The question on that is, was that a one-time only situation because the Governor Plenty did away with GMAC, or was that an ongoing year-to-year thing where Minnesota always had higher reserves, I guess?
Well, the GAMC scenario is what played into the $30 million give back, the donation from UCare. The GAMC didn't fit into anything with the reserves. The question of appropriate reserve levels has been around for a number of years, and it predates the GAMC change. I remember in my first term, you might recall, I'm in my second non-consecutive term, so I served here from 03 through 06. In my first term, there were some discussions about reserve levels, and in the years subsequent to that. And then last year, there was significant discussion. And then, in April, I believe, it was disclosed that the plans in just the 1 year had put $1 billion cash additional into the reserves. And so this has been an ongoing question as to what are the appropriate reserve levels. There was, until the tobacco settlement in 2002, I think that was, or 2003, up until that point, there was a statutory requirement that reserves must be at least X amount, but no more than Y. However, with the tobacco settlement and the hundreds of millions of dollars that resulted in a cash infusion, that statutory prohibition was completely removed, so that the cash that came in could be held in reserve and used for whatever well, basically the blues. And it's been from that point forward, basically, that the question has kind of almost been annually recurring.
Anything else? Thank you for your attention. Thank you so much.
Thank you.